private option is the Arkansas method of expanding Medicaid.
It's just basically taking Medicaid dollars and for some individuals allowing them to purchase health insurance plans on the exchange.
The private option gives Medicaid benefits to Medicaid clients. The private option is paid for with Medicaid dollars. The private option works in the same way as Medicaid because it gives the same services as Medicaid gives.
This should have never been called the Arkansas private option. It's clearly Medicaid expansion, and if legislators wanted to be honest, they would have called it Medicaid expansion.
In fact, what the private option does is it covers about 250,000 people who are able-bodied, working age, and childless. And when healthcare providers see that private option clients get higher reimbursements than traditional Medicaid clients, private option clients are going to go to the head of the line, whereas the truly needy under the private option are going to go to the back of the bus.
I think it's going to create competition within the Medicaid system for resources. I think it's going to do damage to the traditional Medicaid system.
In about 5 years, taxpayers are going to face a very difficult problem. It's the same problem that legislators and government budgeters are going to face, and that's when the federal government stops supplying a 100% match.
We're essentially expending federal debt on a program that in the end is going to have people on the hook in Arkansas that will have to be funded with state tax revenue.
Taxpayers are going to be on the hook for another $200 million. Here in Arkansas, that's real money. How are we going to fill a $200 million hole in our budget?
States, unlike the federal government, cannot print money. And unfortunately, in a case like the private option, it ties legislators' hands in future sessions. They're going to be forced to take a look at their budget and then decide what services now have to be cut.
We're talking about whittling away at the other services that Arkansas provides. Things like higher education, highways, prisons.
Fire, roads, education, mental health services, the critical services that the state needs to provide, they're going to be forced to make cuts.
Eventually, the states are going to have to, come up with at least part of the burden.
So I fear that the likely outcome of Medicaid expansion or the private option is going to involve a gigantic tax increase in just a few years. When Arkansas chooses to expand and then decides later that expansion was a bad idea, there's a possibility that it's going to be faced with a very difficult choice. And that choice is to either continue the expansion forever or refuse all Medicaid dollars. That is an impossible option to take. And what that means is that we are left with Medicaid expansion forever.
We're still under a great deal of direction from the federal government that we really don't have state control over our Medicaid system.
So there's nothing private about this. I mean, this is all, the government is controlling every part of it.
But if you don't have price competition and you don't have competition in goods and services, you can't have a functioning market. That means this is not anything like the private sector, and so the private option is a contradiction in terms.
I think it's very important that legislators in other states especially understand that this is not the solution to the problem. The solution to the problem is to fix Medicaid, not to expand an already broken system.
Yeah, if I had one message to give to legislators in other states, it would be to control the messaging on what this really is. It's really Medicaid expansion. The so-called private option is a method to expand Medicaid.
But when you get into the details and look at the long-term financial part, relying on Washington, D.C., they are still in control of this. I would not encourage any legislator. I would encourage them to say, be patient and wait. Do not make a decision on this just yet.